Hello, my name is Dr. Sharonne Zaks and I work in private general practice in Melbourne and regional Victoria. I know this topic is confronting, but I want to invite you to consider the following questions. Have you ever put yourself in the shoes of one of your patients who has enormous difficulty keeping appointments because of a history of sexual assault? Did you know that there's widespread avoidance of dentists by sexual assault survivors, and that they generally have very poor oral health as a result? Are you aware of the similarities between dental treatment and the sexual assault scenario? Given that most of the time we won't be told, would you know how to recognise the unique combination of fears and behaviours that characterise a history of sexual assault, and how these differ from other causes of dental anxiety? If you were told, would you know how to sensitively handle the disclosure of a sexual assault history? Given that 1 in 3 women and 1 in 6 men in Australia have been sexually assaulted by the age of 18, it follows that a significant portion of our adult patients have this history, and that our young patients are living through it now as children and teenagers. We have an ethical responsibility to these patients, and to this end, I have made an exciting new resource for us. This is based on current neurobiological evidence, collaboration with sexual assault counsellors, and my own experience with a special interest in this area over the last 20 years in private practice. As part of this, I have adapted the current evidence-based best practice approach from the trauma field to dentistry. There is a lecture in 3 parts for dentists. This addresses the questions I began with and is full of practical tips and strategies for before, during and after appointments. These can be used by you and your team straight away. In these videos, I hope to guide you on a journey and that we can work together so that you are armed with the knowledge and tools to help you cope, especially emotionally. There are also videos for survivors addressing their most common concerns that I encourage you all to watch. This is a voluntary project aimed at bridging the gap in our education, sensitivity and skill set in this area. We have an enormous opportunity as dentists to collaborate with our trauma patients and to make a significant impact on their lives. In addition to improving their oral health, we can help them to recover their sense of self-worth, confidence and the ability to control what happens to their bodies. This can turn their lives around, for example, with new opportunities for employment and relationships. For both dentists and survivors, this is incredibly satisfying work. High-quality, trusting relationships can be developed with these patients that continue over a lifetime. Thank you.